South Africa has the highest number of diabetes cases in sub-Saharan Africa. Over 4 million people in this country are diabetic. It's also the second leading cause of death in the country after TB. Now, tomorrow is World Diabetes Day, and I'm joined by Dr. Gugu Mkhize, who is the principal family physician at the Ekurhuleni Health Department. Dr. Mkhize, good evening to you. Thanks for your time. So we're seeing quite a significant burden of disease through diabetes on the country's medical healthcare facilities. Let's talk about the kind of prevalence rates that we have in this country and why they're so high.
You said it in your introduction. It's more than 4 million that have now diabetes because of the lifestyle. We talk about non-communicable diseases as diseases of the lifestyle. Tomorrow we'll be celebrating diabetes and making awareness because so many people now have 1 in 4. When you look at me and you, 1 in 4 would have this. And the lifestyle, what we do, we know that it is, you can get it from hereditary, you know, from age, advanced age, but the way that we're living, we're even getting it with younger people. So with less activities, more sugar food that we eat, and all the inactive things that we're doing, the environment, the hereditary factor, the ethnic group that you come from, all of these things, they make us to be prone to have non-communicable diseases.
One of the difficulties for a country like South Africa, especially when we're dealing with a disease like diabetes, is that women are the biggest sufferers from diabetes.
Yes, women are the biggest sufferers because, as I say, we start with age. You know that we have hormones, and hormones are the reason sometimes that we are prone to so many things. So when we start at a young age, you know that we are the ones that cook. We know that we are the ones that are exposed to so many things. Like we do have polycystic ovarian cyst, which can also lead to diabetes. We know that all these things that we're saying, we're the ones, because we're eating so much food that has got carbohydrates and less activities, then we become more prone. And if at all you are exposed to diabetes before, if your family history, you had it before, you know that you could be getting this. So with a sedentary life, with the gene itself of being female, but even males are also affected. So we have to look, because as we are saying, it is a lifestyle disease that can be prevented if it started early. And we know that we've got different types. We've got type 1 where there's insulin and you are born with it. But that takes about 5%. But 95%, it is something that we can prevent, you know. Then we've got gestational diabetics where your body now is trying to balance how the pancreas is releasing the insulin. So hence that you're saying that women are more prone to diabetes than men.
Let's talk about the relationship between this disease and other comorbidities, because it seems that often where diabetes is identified in somebody, there are also other chronic illnesses.
Let me say the body works as a whole. It helps each other. When there is something, what is diabetes? We know that it is a metabolic disease where the pancreas is not working well. So we know that the body needs sugar in order for it to work, isn't it? So when that is failing, then it means all other systems are going to be affected. So let's say we start from the brain. The brain, you are more prone to having problems with stroke. You can have problems with your eyes, you can have problems with your nerves. Then it goes down because now the cells need to be fitted. It's like when you're having petrol, when there's no petrol in the car, then it cannot move. So the sugar is needed in every part. So as you go down, the heart becomes involved, the kidneys become involved, erectile dysfunction. Then you go down to the nerves. So people saying that I have pins and needles and diabetic foot and all of those because the cells need to be provided with this sugar that is now not sitting in the blood, not being absorbed to do its job.
Let's talk about how we deal with this disease, especially the screening of it, which has such low rates across the country. In fact, you know, there's suggestions that even the figures that we're working with diabetes are under-recorded.
Yes, definitely so. It can start 5 years before what we call pre-diabetes. You will think that you are okay. And it only takes numbers. We talk about numbers. Know your numbers. You just take a blood test, poof, you know, and there, the screen, you know that when you have not eaten, it must be less than 7, it must not be more than 7. When you have had a meal, it must not be over 11. And there are so many places you can even go to your pharmacy. As tomorrow we're going to be having awareness, all the clinics, everywhere where we go, we always carry a kit because it doesn't take a minute. You just prick and then you know that you are having diabetes. But you can also have all the signs that, that will show you that you are predisposed to diabetes. When you know that you are overweight, you are not active, and all of those things. So you just have to start knowing that I cannot see very well now. I'm having challenges with this and this and this. Let me go check.
What are the programs that you're going to be running?
Tomorrow the programs will be starting as we are commemorating the celebrating our thing. We will be starting from the department will be having the World Diabetes Days tomorrow, and it will be cycling through a challenge between Northwest and Gauteng province, amongst other activities. The Deputy Minister and the MEC of Gauteng and the Northwest will be the ones that will be there. Activities of the day will commence with a 40-kilometer interprovincial cycling challenge, where 100 enthusiastic cyclists are expected to participate. The cycling challenges serves as a powerful symbol of the unity and determination of the fight against diabetes. Participants will cycle for wellness to draw attention to the importance of the physical activity and its positive impact on diabetes prevention and management.
All right. No problem. Thank you so much, Dr. Mkhize, for coming into studio and for breaking that down for us.
I hope that tomorrow, as we are going to be in Khutsong Multipurpose Community Center, Carltonville, you'll be there to join us as we cycle, as we have the walk, 5-kilometer walk, and we'll also have so many other activities where we'll be teaching the community more about diabetes.
All right, fantastic. Dr. Gugu Mkhize is with the Ekurhuleni Department of Health. She's the principal family physician there.